My name is Washington Josué Lunariz. My topic is Enhanced Physical Therapy for Arm Function After a Stroke. Definition: Problems with arm function deficit in the upper limbs are very common after a stroke. These upper limb deficits commonly include difficulty moving and coordinating the arms, hands, and fingers, which often results in difficulty performing daily activities such as eating, dressing, and watching. More than half of patients with upper limb deficit after stroke will still have problems many months to years after stroke. Improving arm function is a central element of rehabilitation.
Stroke is a leading cause of adult disability worldwide. It is essential for stroke patients to receive intensive and long-term rehabilitation training to improve their upper limb functions for a more independent life. However, with expanding of stroke population, most of stroke patients lack long-term rehabilitation after discharge from the hospital. It is also challenging for them to travel between home and clinics for outpatient services. We have developed a robotic arm to facilitate self-help upper limb mobile rehabilitation for stroke patients. It is called a mobile axial neuromuscular skeleton. It integrates the advantages of soft robot, exoskeleton, and neuromuscular electrostimulation in one system for intensive physical training on the elbow, wrist, and finger joints. It can be used for patients anywhere, anytime. Its soft and flexible design makes it lightweight, compact in size, and comfortable to wear. With this device, users can incorporate training into their daily livings. It is a great way to supplement the limited training they get from clinical outpatient service. When the robotic arm detects electromyography signals in the user's muscle, it will apply neuroelectromuscular stimulation to contract the muscles. At the same time, it will provide external mechanical forces driven by voluntary muscle signals to assist the patient in making desired movements. We have conducted a trial with 10 stroke patients. After 20-session training, all of them reported better muscle coordination, wrist and finger functions, and less muscle spasticity. Large-scale multi-center clinical trials are ongoing in Hong Kong and mainland China.
Application in physical therapy. The origin of the stimulus varies depending on the objective one. If you focus on activity of holding and walking, the stimulus recepting center is located in the motor control of the trunk and lower extremities, and they are of visual, vestibular, and proprioceptive origin. In the AR, limb is stimulated or for precision activities top, and the main origin is touch. Pros and cons. Pros. With constancy, the mobility of the upper limbs can be recovered in not so long time. There are exercises that you can do at home and help with recovery. Cons. Execution of a bad technique can lead to a more serious injury. In some cases, and different pathologies limit the movements that can be performed of the patient. Is to apply in Ecuador. Upper limb involvement is especially relevant in the glenohumeral joint, where it constitutes a pathological entity in itself. Lower subluxation could injury subacromial syndrome, bicipital tendinitis, frozen shoulder, and in more advanced case, complex regional pain syndrome. It is also common to find stiffness in the wrists and fingers. Conclusion. Task-oriented therapy offers good results in the recovery of components of upper limb functionality such as increased range of motion and increased strength in a chronic patient after suffering a stroke. This exercise will help the person gain independence since they will be able to perform simple tasks such as drinking water or trying their shoes. Thank you.
After a stroke, patients may no longer be able to correctly perform simple everyday movements, such as drinking from a glass. Drinking is still realized as a task, but the impulse sent from the brain is not sufficient to trigger the proper movement. This process can be practiced with functional electrical stimulation to improve motion sequences on a long-term basis. Drinking is realized as a task. Patients are thus motivated to perform the necessary movements. Motion strategies are planned, controlled, and adapted. The EMG function of the electrostimulator measures and enhances the patient's motion impulse to enable successful movement. Multi-channel electrical impulses support motion control. Successful learning depends on the patient actively starting the movement, repeating the movement, and using it in everyday life to obtain long-term success and increase their quality of life.